With more people working from home than ever, our backsides have taken a beating. Many are suffering from something experts call dead butt syndrome. And here to help us get to the bottom of this is my friend, my physical therapist, Dr. Karen Joubert. Welcome to the show.
Hello, it's so nice to see you. I miss you guys. I miss your great audience. It's so nice to see you again.
Well, it's just great, Karen, to have you on the show. So this is not the first I've heard of this. Tell us more. Break down dead butt syndrome for us.
You guys, okay, it does sound funny, but this is real. We also refer to it as gluteal amnesia. Our buttocks has three main muscles: gluteus maximus, gluteus medius, gluteus minimus. Gluteus maximus, the largest muscle in the body. Okay? Underneath that, on both sides of our buttocks, we have our sciatic nerve. The sciatic nerve is the largest nerve in the body. Okay? The pandemic comes, now we're sitting an additional 7 to 10 hours. And so what happens, Dr. Orton, is it's called gluteal amnesia because these muscles shut down. They just forget what to do. On top of which, the muscles in the front, they shorten and get tight, while the ones in our behind lengthen and get weak. So we are in some serious trouble.
So can you just sort of recap the symptoms that we might feel with this dead butt syndrome again, just so we get an idea of that?
What I was hearing, initially, and then I started seeing it more and more and more, my patients would say they were kind of like wiggling, right? And they couldn't get comfortable. And then it was a number of things. They would say they would either start getting an ache in their back, or they would have like a sciatic shooting pain down in their leg, or just random knee pain, random ankle pain, random foot pain, because you're compressing that nerve, right? And that message isn't getting down there. So it can be very, very serious. Now, Dr. Orton, I know you're going to ask me what's the difference between this and sciatica, and we'll go into this. But usually with dead butt syndrome, basically, we're going to say our butt falls asleep, right? We can't facilitate, we can't feel those muscles. When we get up and we move, which we're going to talk about, your symptoms will hopefully go away. With a sciatic type of pain, that pain is going to persist. You're going to have that constant nervy pain, usually down one side of your leg.
Thank you for answering that question. I was dying to ask you. You beat me to it, Karen. So,
I know.
I mean, this is fascinating stuff. And just as an analogy, I've been to you for physical therapy. If you are not using a certain part of your body, ankle, knee, hip, the muscles in that area are not working, you're going to develop a very unique syndrome, right?
Right, and they're going to atrophy. And atrophy can set in, as you know, Dr. Orton, it just depends on your conditioning, but atrophy can set in within a week. And here's I meant to tell you guys this. We had talked, I think, on another segment we did with you. Sitting is the #1 epidemic, you guys. It leads to increased cardiovascular disease, type 2 diabetes. There's like 30 other diseases. Because what happens is when we're sitting there and we're not active, those slow twitch muscles aren't working, and they're the ones that use fatty acid for fuel. And so you start using your fast twitch muscles, which use glucose. So now little by little, you're getting an accumulation of fatty levels in your bloodstream. So it's very dangerous.
So, Dr. Karen,
it sounds so funny, but I really want you guys to understand this is a serious thing.
No, it definitely is.